It's so good to see your face and hear your voice. As always, I'm so excited for this little chat today.
Me too.
Awesome. So today we're here to talk about how to talk to your therapist who's not dizzy about the fact that you're dizzy and you need help with that dizziness. So I'd love if you told us, I mean, I know you are very qualified to talk about this, but I'd love to know kind of what you do, who you are, and
Thank you.
why we're talking about this with you.
Yes. My name is Jen Warner. I'm a clinical social worker and a psychotherapist. I'm licensed in New York, Illinois, Oregon, and Washington. I'm based here in Chicago. And my specialty is trauma therapy related to chronic illness. And so this is such a great question. So I'm so excited to talk about it.
I'm excited too. So, I mean, I guess we can just start with the question, which is, first of all, why does it matter that your therapist understands what you're going through? Do they need to go through it in order for you to be able to treat them? Do you have to have those, or just have to kind of understand? Or does that matter at all?
And that's such a great question. And I would say that first of all, you should always be comfortable in therapy. And I think that everyone should know that, just because you start with a therapist doesn't mean you have to stay with them, right? So you're interviewing them in a lot of ways. And I know that can feel so overwhelming when you're really not feeling well and you just want to start with somebody. But if they don't feel like the right fit, then they're not the right fit. And it's totally okay to say thank you and goodbye.
Yeah.
And I always say to my clients, let's take 3 sessions. If it feels like a good fit, then great. And if not, I will help you to connect with somebody else. So whomever you're working with, you have to start off on the right foot and feel comfortable with them. And the second thing is in your search, and again, I know this can be so hard. As somebody who also lives with a vestibular disorder, when you're not feeling good and you just want to talk to somebody, it's like the idea of being on screens and looking for a therapist or somebody to talk to can feel completely and totally overwhelming.
Totally.
But an easy way to start is if you're on Psychology Today or on Therapy Den or Inclusive Therapist, which is another resource for finding therapists, or on Veda's site. Always make sure that the person, Veda's site obviously has vetted therapists who are familiar with vestibular disorders, but make sure to check and see if the person has added chronic illness to their profile.
Yeah.
Are they chronic illness informed or are they not? So let's kind of start there, that you don't just you really want someone who really understands what's involved with the complexities of chronic illness, just as a baseline, and then we can talk about the vestibular stuff as well.
Absolutely. I think that it's a common thing that people can't find a person who understands dizziness.
Yeah.
I mean, that's a factor for physical therapists and MDs and whoever you're trying to see. So I typically tell my patients if they're in search of a therapist and you're not taking patients, or they're not in the right state to see you or people that I trust or whatever, then I say maybe try and find a therapist who understands chronic pain and chronic illness in general. And that can sometimes be a good jumping point. Is that good advice or bad advice?
No, that's great advice. That's absolutely great advice. And in your interview process with them, when you're talking to them, saying do you understand what vertigo is? Do you understand what vestibular disorders are? And do you feel comfortable talking about chronic illness and chronic pain? Mm-hmm. And really, some therapists might be like, oh yeah, sure, I get that. And some will be very honest and say, no, that's not my specialty.
Mm-hmm.
But yeah, chronic illness and chronic pain is a great way to start.
Mm-hmm.
Yeah.
Cool. I'm glad I'm giving people good advice.
Yeah, no, you're great.
Awesome. And I think that is a good way to start that. And I also think that sometimes if you can't find a provider who knows about your thing, but you're also in a place, I live in a place without a lot of healthcare. And so the thing that I might need or someone else might need might not exist. But someone who's willing to learn about it or do a little bit of research, or if you bring them research and they can say, oh, I know how to interpret this and now I know what to do with you. That can also be a good way to look at it during that interview process, at least for physical therapists as well. That are you willing to learn about my vestibular disorder in my rural town where you might not know things because the specialist might not live there, and that's okay.
Absolutely. I
Totally.
think also, you know, again, a lot of this comes up in the assessment period, because I would hate for anyone to start seeing somebody and then just sort of learn that the person doesn't really know really what you're talking about. I like to ask, and when I'm talking to colleagues, are they familiar not just with chronic illness, chronic pain, which is very important, but the difficulties of what I'm sure many of us know about, which is watchful waiting, the tincture of time, as one of my doctors once said, which is when you really don't know what's coming next, what a new test might reveal, how your dizziness might progress. Are they comfortable holding space with you in the unknowns? Because that's the biggest challenge of living with any chronic condition. It's like, I don't know what's coming next. It causes me fear and anxiety. And much of my session is going to be about talking about that, about you know, being scared, about not knowing. And so that's another important question, because that's different than anxiety, right? It's very, very specific. Are you comfortable with holding space with me around the unknowns that I have to deal with?
Absolutely. And that's such a good, you always have the best words and the ways to put things. And I think that that's such an important point of, can someone, exactly. Can someone be there with me through the things that I am not going to know because I'm going through this ever-changing chronic thing, whether it's migraine or something else that you're dealing with, or more than one thing. It is bound to change. It is bound to be different day to day, year to year. And I get a lot of emails that are like, I don't know what happened. Like, I used to have painful migraine and now I have dizzy migraine and I can't figure out why this is happening and whatever. And I think that's an important thing to recognize, that like these things change in our lives in different seasons, and you're allowed to hold space for not knowing and be anxious and fearful with not knowing. And you're also allowed to talk about it with your therapist, and having someone who understands that is really important.
Yeah, totally. And you know, that fear that comes with, you know, you can be learning lots of skills in therapy, but then you may have a flare. And as part of flares, sometimes our thinking isn't as, you know, fear, it sort of stops our ability to think rationally. And so it's not, you know, if you have a therapist who pushes back on you and is like, well, don't you remember that we talked about this, or we learned this skill, how come you're not putting this skill into practice? That's a bit unfair for a lot of reasons. But, you know, that they also understand that when flares happen, the skills they're not lost, but they can kind of get to feel a little wobbly.
Yeah, and your brain is working so hard to protect you and do everything that it can, and fear is this alarm signal saying, hey, something's going on, right? Dizziness is that alarm, pain is that alarm, fear is that alarm, and it causes you to just go freeze up, which is what your module in Vestibular Group Fit talks about, which is one of my favorite to refer people to. And I think it's such an important thing to say, this is happening, and I do have the tools, but sometimes I need to be gently reminded of that, and that's okay. And even if you need a new tool, or you're like, that ain't working anymore, I don't want to do that, it's okay to give yourself time and space for that too.
Totally. It's about pacing, right? So if anybody who joined is familiar with, you know, long distance running or any kind of endurance training, I mean, chronic illness is like an ultra marathon. So first off, you're a badass for living with this, because you're running, like, it's literally, you're not just running 26.2. This is like 100, 200 mile race. And so there are going to be miles in your race where you're like, I am not feeling so good. So to be able to work with somebody, an awesome provider like Dr. Madison, or a psychotherapist, that can get it and be like, yep, totally hear that. You know, we're at mile 50 and we're not feeling great, but we're going to get there. We're going to get back to a place of regulation. We can get through this, and then again, they can hold space with that. So,
Absolutely.
you know, I think going back to your original question, is like, how do I talk to my maybe non-dizzy therapist about this? It's really about, can you stay with me? Can you work with me through the storms? Because this isn't necessarily going to be a linear type of therapy.
Absolutely. So someone asked in my little box, and I think we can apply this to more than just others. The question specifically is about people in her life or their life, but the question is, why do I want others to understand so badly, and why does that matter to me? And I think that we can apply that to providers too. Like, if I'm not just, but just talking to them about like my dizziness and my fear of that, and they should be able to help with fear and things like that. But why do I want them so badly to understand what I'm feeling?
Well, because it's totally normal to want to be understood, to want to be heard, to be validated. And even if someone doesn't know exactly what you're talking about, for them to be able to relate to, at the very least, the discomfort, again, of the not knowing and of the awfulness of what you're going through. So that's completely understand that you'd want everybody in your life to be like, wow, that, I don't know about that, but that sounds awful, and I'm with you through it.
Yeah, 100%. 100%. And I think that's an important thing for other people in your life. It's on them to have that. It's not on you to force empathy or force sympathy on someone else.
No.
And you are doing your best to live with this day to day. And it's on you to set a boundary and be like, this is what I need you to understand about me, and on them to respect that boundary. And that's a hard thing to do in practice, and holding space for yourself in that, like this proverbial space we keep talking about, right? But it's a hard thing to do in practice, to actually stand by those boundaries, even when you know you need them. And so setting that boundary, saying, this is what I need from you. This is how my expectation of your actions, or whatever it needs to be, whether it's your therapist, your provider, friends and family, and it's their job to respect that and to kind of be there in that way for you.
Yeah, and you know, remembering too that boundaries aren't being mean. You know, it's not like you need to do this. It's, this is what works for me. Here is what I have going on. Here's what's happening for me, and this is what I'm going to need. And if the other person's like, yeah, well, that doesn't work for me, then it's like, okay, well, then I guess we're at an impasse. But most people will say, oh, okay, thanks for telling me that, you know, and I will do my best to work with that. And here's what my boundaries are. You know?
Heck yeah. Someone wants to know how in CBT, so cognitive behavioral therapy, they could, or how do you pivot towards vestibular triggers in therapy? Now, in vestibular therapy, that's like the whole goal, but do you do this in CBT? And is that something that's relevant for you?
So pivot towards vestibular triggers. Can maybe?
I think the question is like, I have a fear of the grocery store or something that's a trigger for me. How does my therapist help me get towards that if they don't understand what I'm going through here, or they don't understand like the grocery store is a trigger? I don't want to spend 45 minutes explaining to them about fluorescent lighting and stimulating environments.
Yeah, well, first of all, I would say again, is that the right therapist for you if you have to spend this much time explaining or justifying what's going on for you? That's way too much work, and that's only going to make your symptoms worse.
Yeah.
If you really have to spend that much time explaining to them why the supermarket and bright lights are a trigger, I will offer that they're probably not the right person. But
yes,
let's say you really do like working with this person, and you know, they should also be, remember, this is a partnership and a team. You're a part of a team that is inviting, as you are progressing in your therapy, working towards managing triggers as they come up. And it should be sort of organic. So it's really also the job of the therapist to recognize, like, you know, you've been talking to me about your fear of the grocery store, and also that you want to be able to get back to that. Let's talk about how to manage these triggers. So that shouldn't, again, No client in therapy should ever feel like they have to do this much work.
Mm-mm.
You know,
Yeah.
like it is, you're coming to a professional so that they can do the work. They are the person who should be with you. And it's like, I'm hearing you. Here's how we're going to do this together. If you ever feel like you're having to work that much, it just might not be the right space or the right thing.
I agree. And I want to offer that your vestibular therapist should act the same.
Yes. Oh, right. Of course. Yes. PT.
Yeah. Yeah. I think that, like, obviously we're here to talk about your therapist in the most, like, that cognitive therapist sense of the word. But if you feel like you have to explain to your vestibular therapist that you need to go to the grocery store and this is why, it's also probably not a good fit. And so maybe seeking help elsewhere can be helpful too. So if you, let's say, I'm just looking at the questions. I can like pull them up in this box that I just learned about 4 seconds ago. If you are in there or in a session with someone and they're like, I have this thing and it's making me really nervous and I'm having fear, and obviously this is not medical or therapeutic advice at all. I know you have some good quick breathing tactics. I know this about you, for like just some fear stuff, but whatever you want to offer, or nothing if you have nothing. But things that if something is immediately fearful, like I have to go to the car and even getting to the car is really fearful, or I know I have to go to the grocery store, but standing in line is really awful for me. Is there anything technique-wise that you like to kind of start with ever, barring that this is educational only? Of course.
Of course, yeah. Well, I mean, our breath is always, you know, we always have access to our breath, and we all know how to breathe. But one thing, so like before, let's say you're leaving your house and you have to go to your car, you have to go to public transportation, you just have to go outside. Just take a moment to do some belly breathing, right? Breathing in through your nose very gently into your belly, so you make a big belly. And then exhale through your mouth. And I always say, make your breath sound like wind in the trees. And if you don't feel comfortable with that, just let your breath go. It's just in through the nose, and then doing that 3 times usually just help take a little bit of the edge off. And let's say you're in line at the grocery store and you start to feel very wobbly, right? First of all, you should always know, first, you can always get out of line. That, I always say that to people. It's like, there is no shame in setting your stuff down and going outside and getting some air. But let's say you don't want to do that. So you're in line. Imagine, we all know what a tripod looks like, right? It's got 3 legs. So you're standing in line and you start to feel like, oh no, like I'm really starting to feel wobbly. Imagine that you have a 3rd leg. It's kind of, you've got your 2 legs, and then you have something that's also helping keep you up. This might be something that you do too with your clients.
Not, but I love this. I'm going to steal it. I'm going to give you credit, but I'm going to steal it.
Tripod standing, so that you've got something that's also helping prop you up here. And remember to just check in, like, are my shoulders up here? Because we all tend to do this when we get very anxious. Can I at the very least bring my shoulders down? Okay, so now I have my 3rd leg, I'm propped up. Am I holding my breath? If so, just exhale. That can let the brain know, I'm okay, I'm okay. And again, you can always leave the store.
Always.
Always.
There's no shame in leaving the store or any event for that matter. Do what's best for you. Always. And I really like that tripod technique. For the people who are ears, everyone should try that. And also, going from up here to kind of down is such an important thing, because obviously it causes neck pain and tension and muscle tension and more anxiety and more stress, but also it makes you less balanced, because if your whole body is stiff, think about a tree. Like, they're always kind of wobbling a little bit, and if it gets really stiff, it just falls over. So you need to be moving a little bit, and that small bit of motion is actually super normal, and it's an important thing to let your body move in that motion. So I like the relax the shoulders too. I know we talked before about how, like, maybe if you have to explain to your therapist for an hour about what you're feeling and not in a therapeutic way, but in a, like, I need you to understand way. They might not be the person. But what if you do like working with them and you're kind of new and you're like, I think that they will listen if I tell them, but I need a way to talk to them and I'm nervous.
Mm-hmm.
What would you say about talking to your therapist if you're nervous about talking to them about what you need?
Mm-hmm.
Do you have any tactics for that?
Yeah, no, absolutely. So I think, one of the very first things that you can do is at the beginning of the session, because remember, this is your time, your session, and this person is there for you,
Mm-hmm.
right? So at the very beginning of the session, you can say to the person, I'd like to talk about something that I'm really nervous about.
Mm-hmm.
I'm really nervous about. And they'll say, hopefully, tell me a little bit more. And then you can share, like, this is the thing that I'm really nervous about. Now, you might not have all the language for it. You might not know exactly how to phrase it. And again, I want to normalize that because all of us who live with vestibular disorders, who live with other types of chronic illness, we think it's like nobody's going to get this. And so we can start to feel really tongue-tied and it creates more anxiety and then it creates more dizziness and then that can lead to a total shutting down. So simply going into your therapist, who's the person there to support you, and say, I'm really feeling really nervous today. Their next question should be, can you tell me what you're feeling nervous about? And you might say, all you can get out is dizziness. I'm just really nervous about dizziness. Okay. Their next question should be, what is it about dizziness that's making you really nervous today?
Mm-hmm.
So again, this is, trust is earned. Mm-hmm. So I can't ever say like, oh, you should just trust your therapist. Trust is earned over a period of time and isn't always earned. Mm-hmm. So, but it's about like recognizing that if I feel safe enough with this person to be here with them, that they can help me find the word and guide the conversation. You do not have to do that much work. You should never have to.
That's an excellent point. Yeah. I mean, you could go in with index cards and a PowerPoint slide, but like that seems like a lot of work and not something to do.
A lot of work, and you might just not have the words on that day, and they can help you find the words and also help you articulate maybe something that you didn't even realize you really were anxious about.
Heck yeah.
Within it. So I hope that answers that question.
That definitely answers that question, and it was better than I even expected, as usual with you. So I appreciate it. Yeah, I just think it's important to be able to talk to your therapist about this. And I also think that this conversation, well, I know this conversation applies to more than just your therapist, more than just your physical therapist, vestibular therapist, whoever it is. Even if you're seeing a regular PT for your ankle injury and you're like, I'm feeling really dizzy today, and saying, I'm really nervous about this, that same thing applies to all of your providers. And if your providers are not there for that, they need to be able to take in all of what's going on with you, not just your ankle, not just your shoulder. Like, you need to kind of see, your therapist needs to see all of these things about you, and I think that that's really important.
Mm-hmm. Mm-hmm. Absolutely. Mm-hmm.
Definitely. This time has flown by. It's been like 25 minutes. I didn't even notice. Is there anything else you want to say about this topic?
I don't think so, unless anybody else has any other questions. And so it's really just like, again, that desire to be understood is totally normal. And, again, working at least with providers, I mean, friends and family can be a slightly different story, but certainly with your provider, you just don't have to do so much work. And I just, that would be my biggest takeaway.
Absolutely. Well, people are loving this information. You're getting a lot of hearts and awesome info and feedback commentary, which I knew was going to happen already. So I appreciate you and your time. Okay, unless anyone has any questions, which you're always allowed to ask in the comments box, I'd love if you could tell us where we can find you. Of course, you can click the link up here with your name on it.
Yeah. So on Instagram, it's just at Jen Wellness Therapy. And then my website is jenwellness.com, Jen with one N.
Awesome.
And yeah, absolutely. feel free to join me.
Awesome.
Sure.
Perfect. You put out a lot of good content, and I appreciate you being here with us today and giving us all this good information.
Oh my gosh. Well, you're my hero of all things vestibular, for real.
Well, thank you. You're my hero of all things calm and kind. So I appreciate you.
Yeah. Anyway, thank you so much for letting me come on and chat with you.
Of course. Thanks so much for being here with me, and I will make sure to tag you and collaborate, Instagram you. I don't know, there's fancy things these days on Instagram that I don't really fully understand. But I'm going to tag you in the thing, and it'll go on your profile.
Thank you.
Perfect. Of course. All right. I'll talk to you soon. Thanks so much for
Awesome weekend.
You too.
Okay.
Bye, Jen.